Good afternoon. My name is Dr. Ananth Mohan Pai. I'm a trained orthopedic surgeon, but currently I am engaged as the cluster CEO of Baby Memorial Hospitals based out of Kerala. We are a regional player. The entire Malabar coast, the southwestern coast, we have hub and spoke model hospitals, and we are trying to replicate quality healthcare uh, in the regional markets. I'm known as a dreamer. Uh, that's why I'm going to make something very, what can I say, a highlighted statement. If I had that capacity to make that change overnight, I would want to make healthcare in India free at the point of cost. Now, what is it that separates or differentiates a developed nation from an underdeveloped nation? And some nations are there never developing. There are three or four matrices. One, availability of good quality healthcare free at the point of cost, free at the point of care to all citizens. Two, excellent public infrastructure for transport and stay. Three, compulsory primary education for all. And four, safety of citizens and especially that of vulnerable ones. So I am telling you the point number one. If I had it in me to change how our country functions, how the healthcare system in our country functions today, I would say that I would want to make it free at the point of care. Can I add a statement to that? India became independent in the year 1947. If India had stayed standing right here in the center of the capital, I shouldn't be saying this. It might sound blasphemous. But historically, if you look at it, the NHS program by the United Kingdom had been started approximately around 1948 and 49. So if India had stayed a colonial estate for 2 more years, the free at the point of care program would have been replicated in India. If you look at the South African system, it functions almost very exactly same to that how NHS system functions. As a practicing surgeon, having practiced orthopedic surgery in India versus in the NHS system, my biggest observation is that in India, healthcare is commoditized. The consult, the surgery, the prescription, the experience of healthcare, it is commoditized. Whereas delivering healthcare is not like going to a hotel and ordering for a cup of tea and having the tea and walking out. The variables are too many. So if I'm asked, the healthcare industry should not be looked upon like any other industry which delivers service. There should be certain differentiation. And that is predominantly because everybody that you serve is a different human being, and different human beings have different physiologies, different pathologies, different psychosocial needs, different socioeconomic statuses. So it cannot be put under one bucket. It has to be individualized. The government definitely is thinking about it. I'm really proud of the Indian government and what from 1947 when we became an independent country to today, we have made human growth. Subsequent governments have come up with several large campaigns. Now, India, you wouldn't see poliomyelitis. When I was a postgraduate student, every next patient was a tuberculosis. You wouldn't see that. But then there is a resurgence of new diseases. There's a change in the pathodemography. Chronic diseases in younger people, cancer, the burden of cancer, infectious diseases in patients who have undergone high value treatments like transplants. So we have made a huge change. We made a sea of change. I'm also proud to say that clinical expertise, which is available in the kingdom, continent, and the states, equally good clinical expertise is available in India. Indian infrastructure is also fantastic. That is why so many people travel from all over the globe to get treated here. And Indian healthcare delivery is still at a fraction of a cost compared to any of the other countries in the world. However, we still have challenges when it comes to primary healthcare. We still have challenges when it comes to antenatal care. We still face challenges in the rural area. So we still face challenges when it comes to availability of vaccines. So there is a sea of difference between what we have achieved and what we still need to achieve. And I'm certain that subsequent governments, as they focus more on primary health care, develop PPP, public-private partnership programs, I'm certain by the year 2030, we will have a much larger and a much better healthcare system. I can say that, added to the selfish note myself, by the time it's 2050, maybe I will be needing a good healthcare system myself. We're all human beings after all. So my motto is work towards something that how you would want to be treated when you need healthcare. Thank you. Congratulations to Financial Express on conducting a phenomenal program such as this. It's a jam-packed auditorium, stellar faculty, a lot of inputs, a lot of learning outcomes, and thank you all.